You are stiff in the hip and you notice, oh, it is increasing, the movement is becoming more difficult. It also hurts. I am Roland Liebscher Bracht, and I will show you 2 exercises while sitting, very simple for everyday life, to attend this discomfort. And the best part is, I will also show you 2 points where you can apply pressure. I will explain the exercises and Sina will show them to you. Sit on your chair and try out a few things there. Just try to simply cross your right leg over your left, just cross it over, exactly. That is often warned against. One should not do that. One should not sit like that. I don't see it that way at all. There is absolutely nothing wrong with always changing the situation, the position from time to time. If you come this far, then now check if you can also cross your leg, cross your shins. Sina can do it. If you can't do that, which is often the case, there are exercises that you can do to improve the situation. Grab the loop or a belt or towel, whichever you find. And then take your foot down first. Simply cross it over the other one and take the loop around it. Put the loop around it, just around the foot. And then you start pulling up very carefully and feel inside. Maybe it only goes up to there. If it only goes up to there, then you simply do the exercise there. Practically hold on, arch your back, go all the way into the hollow back. And while staying in the hollow back, you bring your torso further and further forward, and then you notice now here, we are practicing for the right side. If you have the problem on the left, you have to do it on the left as well. Then you may notice that it stretches in the buttocks, where it hurts, where you feel the pain, where the sensitivity is, then you are exactly right. And then maybe a few days later, a few weeks later, you'll come a whole lot higher, maybe go a little higher now. So you adjust the height at which you lift your foot according to how you can flex the leg. And there is another modification you can do. Let go of the loop, now stretch your left leg, and now place your right foot over the left. Now you have, so to speak, an ascending path in your left shin, which allows you to work your way up bit by bit. And sometimes it is also the case that when you fully extend, you come over with the foot, with the right one, over the knee. And then you can practically start like this and gradually bend your left knee more and more. Yes, bend a little more and a little more and a little more and a little more until the lower leg is vertical. Pull until it is vertical. You may reach up to here, just try out what suits you better. But the important thing is that you eventually arrive to this position. And then it may be that the knee is initially just like that, so it doesn't come down properly yet. Then you place your right elbow on your right knee and simply press it down further with each repetition of the exercise. It won't happen as quickly as it does for Sina, of course, because that would be too short for you if it didn't work before, and you have to slowly work on it. So let's focus on the position of the trunk again. You have to arch your back completely. Why arch your back? So that you do not perform the stretch in the trunk, but in the hip joint axis, which is located approximately here. That means from here upwards, the back actually has to remain straight in one piece, and only down here the trunk practically goes forward. And now there is only one trick. You focus on your navel. And you focus on making sure that the upper torso does not move forward, but that the belly button moves forward. And when the navel moves forward, then you have the effect that you stay in the hollow back and that you have the whole stretch, yes. But you are already bending a little at the top, yes, exactly, only at the bottom, Sina, only at the bottom, and the belly button goes forward. Yes, not above, only below. And somewhere it just stops, yes. But going further forward at the top would not bring any relief to your hip joint, which is why this precise positioning is so important. And that's the basic exercise. Now there are measures to stretch more into the area that personally torments you, where your bottleneck is. Most of the time it is like this. When you have achieved this basic stretch and go forward, you slightly go to the left. So from the leg that you are currently stretching, move away slightly to the left so that it then pulls more intensely in the right buttock. And remember, the intense pulling is always what makes the exercise valuable. When you do an exercise and it is already easy for you, it will not have any effect. So the more it pulls, the less it hurts. It must still be bearable. In a positive sense, it should be just a comfortable pain, and then everything is wonderful. If you can't really feel good on both hips right now, then just do this exercise once for the right side and once for the left side. But you will notice daily how much is already happening there. So that you really have all the information on stretching, we have made a guide for that, where everything is wonderfully explained. You can download it. Every piece of information for your pain relief is valuable information. And now we come to the second exercise. In the second exercise, you stay sitting on the chair, as you see with Sina, and now do the following. Go a little further forward. You have to try this at home on your chair. I'll show you what it's about. You now take the right foot and place it under the chair. Yes, as far as possible, and slide forward so far that you do not slip off. Attention please, do not slide too far forward to avoid slipping off. So, and now you go back with the navel and move with your torso, because the navel goes back, not up, but down towards the back. Now we do the same in reverse. Earlier we stretched the buttocks, now we are stretching the front groin, because when both are stretched, 80–90% of the difficulties are usually eliminated. Yes. Hold on tight, Sina, hold on tight now, and aim for your belly button and pull in your stomach. Now go back further and further back so that the pelvis tilts and it may start to pull. It is also important that the leg is bent, because this way a muscle is also included in the stretching that has a lot to do with hip flexion next to the hip flexor. And when both of these are free, yes, then usually the hip is already much freer. Keep working further back, 2 to 2.5 minutes, but the whole thing really depends on the fact that the pelvis is taken back. We might show it wrong again so you can see how it should not be. Stay like this and now overextend in the lumbar spine. Yes, now you see Ina is coming back with her trunk, but the pelvis is not moving properly, and that's why the most important stretch is missing. So, once again, straight initial position, the abdomen wants to go back, and then the abdomen goes back with the pelvis. You may not achieve this right away because the body is not used to it, but if you practice regularly for 2 or 3 days, it will get better. And then it starts to pull here over the entire thigh, it pulls in the groin, it may pull in the back, all of that is okay, that way the hip becomes freer. But now we're going to really dig out the tricks, because now I'll show you how Sina can push herself. You can do this very comfortably while sitting on the chair, sit down, completely relaxed, and you can see it nicely now with Sina, because the pants are tight. Because it is important now to see where your foot is and where the thigh is. Because you are now making a straight line from the crotch towards the thigh, show yourself straight out from the crotch. Practically here in this direction, exactly in this direction, and now about halfway between from the side and from above, so between diagonally, there please take the left thumb. And go deep there, yes, that's where the point of the hip flexor is, where the attachment is, and when you press on it, it immediately releases and relieves you. To find it, there's a trick, and that is, take your left hand to the inside of your right knee, the right thumb roughly to the area where you were just now. And now take your knee to the left, and then you will notice the adductors, these thigh muscles, tighten up, then go as far to the right until you notice, so that it's not so tense there anymore. There's sort of a bark, so to speak. Do you have that? And there you go in that direction, preferably using the pusher or take a wine cork. Or take something else, maybe from the bottle. No, take a wine. No, a champagne bottle. Now I got it. A champagne bottle has a cork at the top that overlaps. There you can take the champagne bottle and can place it nicely in this direction and then look for the point or another household item. Sina takes the osteopressure tool. Where your thumb is, you now place it there and try to feel, but you must not be too deep because down there, further towards the ground, there is a lot of muscle mass from the adductors. Look for it. Yes, you are too deep now. A little higher, a little higher. Let me show you. Look, it could be there. There, the face, I don't know if you saw it, but there was the face right there. Oh, it hurts, and you have to love this pain because you have to keep practicing with it. This is a bit more exercise intensive than our other exercises, but it's worth it. Once you've done it 5 to 10 times, you'll find this quite easily, and you can always quickly help yourself in between, right? And then you stay on this spot, which also develops a certain sensitivity, a certain pain intensity, and then you just stay on it and wait until the pain subsides. Because it decreases, because these spots connect with the receptors in your brain and cause relaxation of the hip flexor, and as it relaxes, the pressure decreases. And that's why, it takes some time, 1, 2, 3 minutes maybe. That's why we also take the plunger or this other household item that you use. Because the fingers, if one is not used to it, then rather cannot endure it, right? And with this one point, you will notice your hip is already noticeably lighter. And then a second point is added, then we personally take a few cones with the flat tip here. You can also, for example, take a small ball like a dog toy or something else that has a similar bulge, and what do you do there? You just sit on it, okay? Put it underneath Sina, and now just try, when you're sitting on it, where is it uncomfortable, okay? Where does it hurt? And all the spots you find there that hurt, just stay on them, and you can write, you can eat, whatever you want to do, and the whole thing calms down. Try it out, you will be thrilled. And we have another video for you, an explanatory video on how hip pain develops. Please click here, download it, and enjoy all the explanations. And Sina and I say goodbye.